What are the things that pharmacists do on day-to-day basis that not kind of normal person that just comes to, for example, the counter to for their medicine sees that is really important, and you think people should know about it?
Well, I think for one as like to begin with, there are many different areas of pharmacy. So when you think about an aspect that people don't know about, I think is even understanding that there are pharmacists in a lot of areas. So you think of pharmacists typically as a person in the pharmacy in the store, but there are also pharmacists in the hospital. So wherever anyone has medical care, they're admitted to a hospital, there are whole teams of pharmacists watching over their medication use, kind of deciding with doctors. And even when you go to your insurance company, for example, insurance companies have pharmacists. And when you think of drug companies, for example, when they're doing medication development, drug research, there are pharmacists there as well. So if I were to talk about any specific thing, I think I would want to look even broader to step back and realize how prevalent pharmacists are. Day to day, I think if we really thought about something specific that we do, it would probably be safety checking. That takes up a lot of pharmacist time is the checking of medication interactions of a new medication versus everything else a person has on file, and then doing that for each individual person.
Interesting, interesting. And you are in the hospital kind of pharmacist, or okay,
Yes, that's right. Yeah, I
okay,
work in a
okay.
hospital. Yeah.
Okay. And well, like to get back to that more of a specific example, and do you have like, did you like have any stories that maybe a pharmacist like was like checking medication for somebody and it was like it could even save lives?
Yeah, definitely a lot of that is what we do day to day is the safety checking, and then we hope that, this has prevented something down the line. But I can give examples of situations where maybe the checks, like we didn't get to check because sometimes there are a lot of things going on in the hospital, and where there isn't pharmacist involvement, sometimes can slip through the cracks as well. I think there was a case where a patient came into the emergency department and they're giving all these medications like anti-nausea medications, medications to help with heart rate because the person had a very fast heart rate, or something we call a QTC prolongation, where there is an irregularity in the heart rate. And certain medications can actually make that even worse to the point where they may have irregular rhythm that causes irregular heartbeats. Like if you think of the heart monitor going all haywire. So in this case, because it was the emergency department and they do everything so fast, a pharmacist didn't get the time to intervene. And so they gave this medication that actually made someone's heart rate even worse. And the patient had like a code blue, which is where they needed to be resuscitated. Yeah. So situations like that, I would say, is the biggest factor why pharmacists want to be involved. Like we really care and we know that medications can't all be used safely in all situations. So that's where we want to be involved and what we hope to prevent at the end of the day.
For sure, like a lot of people kind of didn't know this kind of process that was going behind the door. But to even get a little bit more of that kind of medication use, that I think at least in like my country or something like that, you use medicine something like just a pill. You just take it. You don't really like care about it. But I think there's more into that. And how do you think people? What like even what's the process of kind of even when you are picking yourself like some like drug or medicine? How people should kind of go on with it, like use it and use it in a safe way that they can avoid all of the kind of just things and bad things that can happen to them. And even with picking the medicine, I think that's like where most people start, and I think people can make a lot of mistakes there.
Yeah, I think when it comes to picking medications, having a pharmacist help you is really important. And generally, pharmacists, like, we want to help people achieve the results they want, right? So being clear about what your intentions are, what you're looking for, what kinds of side effects are really important that you avoid for you personally as well. So I think like being upfront and giving that information to a pharmacist will really help them be able to pick medications for somebody and do it safely. Similarly with natural health products, right? Like vitamins, these other less regulated products that are sold online. I think the pharmacists in general, speaking for myself, but I would say for my colleagues as well, like we would rather people talk to us about them so that we have a chance to talk about the safety aspect, how it can be used with other things that they're taking.
Interesting. And what do you think are the maybe even kind of questions people even should ask those pharmacists to pick the best medicine for them?
Yeah, I think the best way to start would be to give a list of their existing medications and supplements that they're taking, other health conditions that they have right now, and then to ask just simply like, I'm trying to get this result. Will this help me or will it do me more harm than good? I think that's a pretty good place to start. Yeah.
Yeah. And with kind of taking the medicine, it should be like what the pharmacist just tells you to do, or is there something specific?
Generally, when taking the medication, the pharmacist, like a good pharmacist, should lay out the directions for the person in clear words so that they understand how to take it. That's generally what we're trained to do as well. When it comes to them following directions, obviously you want to follow the recommended directions as much as possible. But if you're having difficulty, like if anybody has difficulty with that, say maybe the timing is difficult or their schedules are really busy, it's best to then tell that to the pharmacist so the pharmacist can find other options for them, whether that be changing the times, changing the dose strength, or even changing medications. That's all stuff that we can help with.
Interesting. It seems like even pharmacist is a lot about communication, and wanted to know if that they teach that in school, like communication with kind of patients and how to clearly communicate like what people need and other stuff.
Yeah, certainly we get taught that a lot. So part of our job, if you think about it, is teaching because we are trying to teach people from all different backgrounds about their medication, how to use them safely. So it's really important that we are able to adjust our language, our communication, our nonverbal communication as well, so that we can effectively get through to people who maybe have different cultural understandings of communication or are different language proficiency levels. So, yeah, we do get trained in that a lot.
Interesting. I don't know, like, can you give me even some examples, even for the non-verbal kind of type of communications, even maybe some tactics like that you use because I've never heard about this and
Yeah, yeah, for sure. So, I would say some basic nonverbal communication cues that apply in all situations, right? It's not just for pharmacists, but it's told to us as well. Is like, we're standing straight forward with our chest facing the person. We have our hands within like a reasonable area where it's visible, so we're not like hiding hands or crossing arms. That can be seen as unapproachable. And then similarly, we want to speak clearly in simple language. So generally for us, from a North America perspective, like grade 5 or grade 6 proficiency is about the maximum, like the highest level of complexity that we want to go. And then yeah, pretty much just being welcoming. If there's anything that, the patient is maybe upset, we still want to maintain that focus, that attention on them, but de-escalating. So still like none of this, none of like this or anything like that. So
yeah,
being as approachable and being as simple as possible so that people know what to expect from us.
interesting. And yeah, like honestly makes sense a lot. And like I would want to even get more into traveling and kind of all of these medicines because I think it's a big topic, and I know you're kind of a traveler, so I think you know your stuff. So, what are the things people should look out for when traveling?
Yeah, I think traveling, going to any new area, people have to understand that the food there has a different collection of bacteria or like native species that are microscopic, that aren't even visible to us. So then a lot of people, when they travel, they may get diarrhea, basically. Their guts are receiving this new group of bacteria that we're completely unused to. And that's usually what causes a lot of snafus with people's vacation, like having to poo a lot while they're meant to be having fun and things like that. So I did make a video similarly on this, which is explaining why taking probiotics when you're traveling, it is important to take probiotics in the area that you're going to, because you want bacteria, like good bacteria that is local to the area you're visiting, so that you have less of a shock to your system taking in the bacteria on the food versus the bacteria that you brought, halfway around the world where you used to be, right? So I'd say that's one aspect. So making sure to plan ahead with your vaccines and also your medications before you leave. So I have a story actually. I went to China last August because I was visiting family, and throughout the whole time, like they had told me they were taking me to this high mountainous region. I was like, okay, sure, I'll do a road trip. And it turned out to be Tibet. So then suddenly I found myself like 4,000 meters above sea level. And I had terrible, terrible altitude sickness. But I did not prepare enough because I thought there would be medication that I'm used to in China, because I thought I would be getting Diamox, which is an altitude sickness medication. I thought, oh, I'll just go there and I'll show up and then I'll grab it when the time comes. They did not have that medication in the pharmacy. So I was running around everywhere and I actually did not end up finding it. And I had like terrible, terrible nausea, so ill, so sleepy, because I assumed that this new location had medication I was used to, but they didn't.
No, yeah. And for example, like when you're in the country and for example, you're under prepare or even with buying medicine in other country, is that just about the kind of making just doing your research and kind of knowing what's medicine is in there? Because I think if like even when I like really like want to travel and I watch all of those vlogs and somebody gets sick, I think especially if when you're from other country, it is really kind of complicated to find the right medicine, especially when, for example, in your case, they don't have the one you want and kinda you don't know like how what works, and even there may be a language barrier. So how would you kinda give people advice on that when they're like in other country and something happens and you need to kind of find the right
Hmm.
medicine?
Yeah, I think to begin with, it's important to understand how medications are actually delivered to people, like how people actually get the medication in hand in that country. Like that's very different. For example, if you go to another country, they won't accept prescriptions from your doctor, right? They usually will restrict it to a prescribing doctor in that country or even in that specific state or province. And then in order to get that, you need to then take that to a pharmacy to get the medication. But then, well, like we said, other countries have completely different lists of medications to begin with. So I think when traveling, it's important to prepare the medications that you have already and get enough supply of them to last you throughout the entire duration of your trip and then some, because there are flight delays. There are, sudden emergency events that keep you from going home on time, and you still need medication to last you that extra few days or few weeks. So keeping extra on hand, preparing ahead of time, and also knowing that different countries have different laws when it comes to medication. There are certain medications that are approved in one country that are illegal and completely illegal to even have in other countries. So having documentation for those is important too. I have read about travel advisories for certain countries where they will ask you to have your original prescription for your ADHD medications, for example. And that is something you need to prepare ahead of time so that when you show up at customs or they ask you these questions, you don't get into trouble because you're possessing illegal or controlled substance in another country, basically.
I never thought about that, and like, and the question comes to my why are some kind of medication just absolutely banned in some country, but normally used in other one? Like, it the kind of doesn't just I can make sense of it because, like, at least for me, it's like, it's just medication. It kind of should help. So why is it banned in other countries?
Yeah, and that really comes down to how each country's FDA or Health Canada equivalent, like their regulatory body, decides what medication is genuinely useful versus it has no use whatsoever and it actually has harm. And that comes down to each individual country. Like I can give an example, which is there is an anti-seizure medication in Canada and the US called Epidiolex. And this is a highly purified pharmaceutical grade very expensive drug made from CBD, which is marijuana based. So if you were to take this anti-seizure drug to a country in Asia like China or Macau, Singapore, similarly, you would be you would be illegal. It would be illegal for you to do that because it's marijuana based. Their country's regulatory bodies have not determined that this is a genuine, legitimate use for CBD. And even though it's a very specific, like this is not any dispensary product, this is a highly regulated, highly formulated pharmaceutical grade product, it's still seen as, marijuana product to them. And so it's important to have that kind of thought if you think you may have any drug that could be seen that way by another country. Especially, I think, right now with stimulant drugs, like for ADHD meds as well.
Interesting. And where do kind of people, like, when, for example, they have those kind of drugs or medicine they in other country would be illegal, then like what should they take so they make sure that even like on the kind when they're how's it called in like a plane or so, like, and they make sure that they don't like it's not illegal and they all have all the right papers, so like there aren't any problems. Like where can people get those?
Yeah, so it's important to search up the requirements of the country you're going to. I know for the US, for example, they will publish what is required of travelers with potentially controlled medications. Usually that includes your original prescription, like a photocopy of your prescription from your doctor. It may include a letter from your doctor who says why this drug is important to you and why you need to continue having it with you while you're in this country. And then the supply of the medication itself, it has to be in your original prescription bottle with your name on it, with a description of what it is and the directions for it, so that it's not pills in a little baggie, for example. That would
Yeah.
look really suspicious. So it's really making it as legitimate as possible with the documentation that you already have to back it up.
And it was about a lot of people, especially like in my country, love to take medicine from other countries for like any reason because like they think it's better just because, all of those other factors. Like, what do you think about that? And, even buying medicines from other countries, using it and kind of all of the stuff around it.
In my personal opinion, I think it's up to the individual and how they feel about it. If you look any deeper, or if they were to research any deeper, they would understand that pharmaceutical manufacturing is already a very global process. India is actually one of the countries that manufactures a large portion of the world's drugs, even for North American markets, because simply in China as well, like they have the raw ingredients, they have it in scale, they have it with already expertise in pharmaceutical manufacturing. So I think if it is a concern about quality the large company scale, I don't think it's a necessarily a valid huge concern. But it may be down to like supplements, for example, because supplements are already very loosely regulated. That may be a preference they have for manufacturing in different countries. But I think on a global scale, when it comes to legitimate prescription drugs that are approved in multiple countries, people will find that the supply chain is already very global, and where they buy that medication from may not actually be where it's made.
Interesting. Yeah. Okay, then you know what, like one of the like questions I had is, what do you wish like every person knew about kind of taking medicine or just kind of the drugs and kind of this all of this whole field of just taking medicine and taking all of those, even like a supplement you wish that every person knew.
Yeah, something that I wish everyone knew. I wish that everyone knew that taking medication, taking a supplement is still a habit and that healthy habits matter. So, exercising 3 times a week, eating healthy, minimizing sugar, low glycemic foods, like these are all healthy habits that we generally understand are good for our health, but it may be difficult to go to the gym like 3 times a week or eat all these unfun foods. But taking a medication is doing the same thing. It's still a habit, and it's a habit that sometimes comes with side effects. So then it's a choice between like which habits do I want to take? Do I want to have a 3-second pill habit, taking a pill every day, but then taking maybe like 5 or 6 pills a day versus doing the harder habits like going to the gym, eating healthy, paying more for like a better air quality, for example.
But yeah, I think that not many people knew about this. But yeah, essentially, like a lot of things are just habits, even if we are like conscious or like they're conscious or unconscious. It is like I think with habits, I don't think you always have it figured out. Like you kind of check this right code and or you find the right method, and all of a sudden everything will be easier. But also with healthy habits, I think it's more about there. Like I think there are a lot of books on habits, so I think if people like want to even build habits, they should turn to those. But with habits, it is more of like about not to like go off topic or too much, but about just kind of even making it with another habit, kind of connecting it, even making sure it's easy and sustainable, and even small actions can count. So that's kind of my take on it, and I absolutely agree. I think if people build more better habits, I think even then they could like take less supplements, even like with the vitamins. I think a lot of people like are taking even more of those than they should. Don't know how you see it.
Mm. Yeah, I think with the number of supplements people are taking, there's a reason that these products or these chemicals or supplements is because they're not potent enough to be used as medication, really. It's like their effect is minimal. So we assume their harm is minimal, but because their effect is little, that's the reason that companies and healthcare systems don't use them as actual medicines. So then it comes down to if you're not getting that much effect, is it worth paying a whole ton of money for it? Which is, I would say, is my personal opinion against taking too many supplements. Is that it's it's taking people's money for very little benefit when they could be using that energy or that money towards something better that will help improve their health more. Yeah, because when
Interesting.
you think about supplements, like people could be spending like over $3 to $5 a day, like US dollars a day on just supplement pills. And that's really expensive. That's over $150 a month if you break it down. Because some of these supplements are not cheap, right? Especially when you see them marketed online and so on. So the hype is real. The effects may be real, maybe not. The financial impact is real.
Interesting. I've got yeah, I've never like took this perspective on supplements. when it comes to even making it like being it, because I think most people think like it's a supplement, like you're kind of spending money on your health, that's nothing. But yes, the compound interest, I think it's real, and yeah, as you said, like it's a lot of money for something that may not have like the benefits, and especially with the marketing. If like I wanted to even get more into like all of those doctors like online, I think like most of them like really do want to help and are great, and I watch them a lot, but I think there are like a lot of people, or even you mentioned in one of your videos these AI doctors that mm, kind of make these videos and like talking about a lot of like mm, just honestly bad content that is not true. And with that, I think there can be even this supplements kind of in like intake. They create a product that just maybe just harmless, or even like have a like this like bad effect on people, but it's like it's marketed a lot, and people just buy it because it's a lot of money. So I think that's a big thing like in the industry right now, especially like from kind of marketing and business perspective.
Yeah, yeah, I definitely agree. And I think it plays back into that thing we talked about where taking a pill is a habit, right? So I think people get drawn in because they think this is a habit. I'm doing a good thing every day for my health. But still, like they're paying to take this supplement to have this habit instead of maybe another habit that is more difficult that could impact their health more and help them more.
Mhm. Yeah, of course. And with that, what are the for like on the topic of supplements that we started? What do you think like are like supplements that people? Of course, it's individual, but supplements maybe even people should look into, or people don't know the real effects that they see some vitamin or see something, and they see this kind of like big headline, it helps with this, that, and that, and don't really look into it. What are the like things and supplements that people should look out for? Like we talked about like looking on things within medicine, but I think there's like even more in supplements.
Yeah, I think that generally everyone should consider a calcium supplement. It's really important to maintain that bone density as people age. And I think it's quite stark actually if you were to look at the number of people with osteoporosis or like low bone density as they age past the age of like 60 even. It's quite high. I believe it's like it would be over 50% of the male or female population. Like people start losing bone density and that puts them at risk of fractures. The thing is we don't consider fractures to be scary because we think from a young person's perspective, oh, I'll just heal that. But when you're 60, when you're 80 and you land in the hospital with a fracture, there are so many other things that can go wrong. And I think if you were to ask any healthcare professional who works in a hospital, they would agree, is once people get that first fall, like their grandparents or their elderly parent gets that first fall, it's kind of a really easy downhill slide from there. And they, even if they, stop the process, they don't get any more sick, it's hard to actually bounce back from that. So I think a calcium supplement, those are very prevalent. They're very cheap. They can even be tasty. I personally eat Tums. Like I chew Tums to get my calcium in. That's a big one. Another one would be vitamin D. So I live in Canada and there is very little sunlight here. And so vitamin D is then required for calcium absorption in the body. So a lot of people in Canada are vitamin D deficient as well.
Yeah, so basically, it even depends on the country you're from. That maybe, especially as you said, you have not a lot of sunlight, so you take a vitamin D. But for example, I don't know what are the other examples, but for somebody in other country that may have like this other thing that they will kind of use that for like even like other vitamin.
Yes, yeah, I think the vitamin itself is dependent on the living situation for sure. And then it just comes down to learning a bit about the area that you live in and what specific deficiencies are important, but actually learning from legitimate resources, right? Like you could end up on somebody's blog saying that you are missing selenium, but the average person like you're not deficient in selenium.
Yeah. Was that like finding legitimate information and resources about medicine, especially like I think medicine is field that is constantly changing and then like depends like in a lot of cases like even on the individual country and there are a lot of things to take the context. How can people even on the like when they're finding something on the internet find like legitimate information for like this medicine, like pharmacy thing or vitamin supplements. And what like kind of what should they believe? How can they, for example, tell that this like is a hoax, especially if they don't know much about like vitamin supplements and they are not in this kind of medicine field.
Yeah, yeah, I understand. It's pretty difficult to find legitimate resources. I think from the healthcare professional standpoint, we get access to these resources like up to date or natural medicines, which are resources that I would say healthcare professionals use, but usually they're paid and we get them as access because we work for a larger organization, for example. But I think if you currently go to university, look up what resources your school has already subscribed to. And usually they will open up that subscription to all students, like they don't specify department. So that was an easy way to get access to some of these paid resources to look them up. You sometimes could choose to pay for a subscription yourself. I think there are also resources online that are free that are reasonably reliable, like Merck Index. And then, of course, when you rely on articles published online on a website, or for example, looking at the credentials of the person who wrote that article, and if they don't have a listed person's name who wrote that article, that should be something also to consider. That would be a little suspicious if they won't put anybody's name or credentials behind it. And yeah, it's really asking those deeper questions about who is writing this. Are they selling something to me directly? And if any like objective, legitimate university sourced listings I have are saying the same thing.
Do you subscribe to any kind of this even pharmacy kind of newsletters or something like that that you know are just they have legitimate information and you believe them?
Yeah, so I usually search for my questions on UpToDate, which is a resource a lot of clinicians in North America, like Canada and the US, use. I look up medications on natural medicines as well, which summarize a lot of the supplements that are popular or even just exist out there. Newsletters, otherwise, I try to read news briefs from my National Society of Hospital Pharmacists. So they will sometimes send out newsletters that way too. Yeah.
Okay, yeah. I wanted to like get more into because when I was kind of researching in the kind of pharmacy field, I think I found this podcast and I think it's like concerned that many people think that there are some people that think like may have arguments for this that pharmacy or this kind of this whole industry of even supplements is trying to just to sell you something and not really trying to help you, that there are those kind of just herbs or fruits that you should eat and you will have all the vitamins in the world and you will have everything you need, which is I wanted to know like your opinion on that as a pharmacist and your opinion on those people that like I think even you may like even meet them in hospital that are like I don't need like those medicines, I don't need those supplements, vitamins, like I have everything I need, or I will just take some herbs and all of it. So yeah, I wanted to know your opinion on that.
Yeah. So my opinion, in those situations, there are definitely people and groups of people like that who exist. I come from the understanding that usually there is a reason they think that way. So maybe they had an experience in the past where they had a really negative interaction with a healthcare professional, with a doctor who, betrayed their trust in some way or did something that they were not quite on board with and they did not fully understand or agree with. So that kind of sets off their interactions or their worry moving forward. So I try to come from that understanding perspective. And then when that comes up in discussion, I try to ask people like, what is your thinking here? Like, what concerns you about this treatment or this medication exactly? And I try to actually be able to answer those questions that they have. And I don't force people, right? Because you can never really force people to do something on their own time, like rely on them to go leave hospital, take medication unwitnessed privately if they don't actually want to do that. Like there's no point really trying to force that or trying to like play it out so that like they end up taking the prescription because once people go home they will do what they want to do on their own. So then it's really addressing that like underlying thought for me. Yeah. And then for the people who actually show up to hospital, I will say there's already a certain level of understanding that they need medical attention. And it's just building on that understanding to get them to know what the treatment is, what this medication is doing, what the purpose is, and how that plays into their already expressed wishes to receive care.
Interesting. And I think like something that is interesting. I think you even made a video about like this herb, like Chinese herb that is really like does help for like coughing and all of those stuff. So I wanted to ask if you have any more even like in America that people even may use because I come from the background that yes, of course, medicine, like it can be useful, and you should like take it like talk to even pharmacists and all of that. But a lot of even my medicine that I took when I was little was just all of those herbs, and always when I'm kind of even sick, I just drink a lot of tea from this herb like we took from the garden and all of that. So I think that's like an important and useful part, and people even in America or other countries could kind of know more about. So I wanted to know kind of your kind of wisdom on that.
I will say a lot of that is probably from my mom. So, my mom is trained in traditional Chinese medicine because in China, in medical school in China, they have a stream where you become a medical doctor and your specialty is using traditional Chinese medicine. So, that's actually what she studied. So, a lot of the stuff that she fed me growing up was a lot of herbs and stuff as well. And I didn't fully understand it. Some of it to me, like I can tell it works because my throat is not in pain anymore. But if you were to ask me to explain which ingredient does what, I don't have that level of knowledge. Like I didn't learn that. It's really just eating what my mom tells me to eat. Yeah.
Yeah, well, I'm the
For
same,
yeah.
honestly.
Yeah. Yeah, for the more commercialized products like the cough syrup that I showed in that video, I think there are those few recipes that a lot of people find effective that are like really also easy to commercialize at scale too because it requires extraction having those many herbs and putting it in a format that is appealing to many people because I'm not sure if this is the case with your traditional medicine as well, but traditional Chinese medicine is usually like very very bitter. Majority of their recipes are like extremely unappealing. So
Yeah, oh, it depends what kind, because most of it is just kinda you just take a herb, you can dry it out, and then you make a tea out of it or something like that. But like those like traditional ones, like I'm not even sure I know a lot of them, you know. So, but most of it is you with the tea, you kind of just pour syrup into it because it mostly tastes like nothing or has a little bit bitterness to it. So that's kind of like from my country.
I see. Yeah. That's nice.
Okay. And I wanted to get more into like a little bit your story because I think it's super interesting that like I think it's yours to tell. So how did you even like get here? How did you start at this pharmacy, get into Vancouver and all of that?
Okay, that's it's a long time because I'm not a young person. I got like multiple decades of story. I guess if I were to summarize briefly from the beginning, I was born in China in the Northeast, and then I moved to Vancouver with my parents when I was about 6. Here, I did all of my schooling through grade 1, through university, where I stayed local and I did a degree in cell biology and genetics. I spent a year with a research team at McGill in Montreal. And then I came back and I decided, oh, I'm not sure if I really, really want to work in a lab for the rest of my time. So then I applied to different clinical and patient facing roles. So I applied to nursing school, I applied to pharmacy school, I applied to medical school, and then I got into pharmacy and nursing. And I decided that I would go to pharmacy. And while I was in pharmacy, I found that I did really well. So I was good at school. I found it easy to make connections and branch out professionally. So while I was in pharmacy school, I was really involved with pharmacy advocacy initiatives. So in my province in Canada, that was around the time when we brought in pharmacist prescribing. So I was also one of the first group of people to prescribe under my own name in the pharmacy. And I thought that was really interesting. After that experience, I then went on to apply to pharmacy residency, which is the specialized hospital training that pharmacists get to work at the bedside. And after I finished that training, I went to work as a clinical pharmacist. While I was working as a clinical pharmacist, I thought, why should people have to be so sick to the point they come to hospital by the time they actually see me and get my input on their health and their medications? Because we train a lot, and especially for hospital pharmacy, like there is a lot of specific health knowledge required for these inpatient clinical pharmacists. And I thought it would be important to talk about the things I learned so that people don't learn it all the way at the time when they're already sick, right? And truthfully, I will say community pharmacists, like pharmacists who you see in stores, they are very bogged down with little time left to really delve into these things as much as they want to, as much as they are passionate, as knowledgeable as they are. Like they have a lot of time pressure to get through as many scripts as possible because usually they work for private companies or for profit store companies. Whereas I have the benefit in a Canadian system where people don't pay anything to come see me in the hospital. But then the caveat is that they have to be sick enough to come to hospital. So that's my thought process of why I started on social media, is to talk about health specifically in my own style, which is very Gen Z, very edited towards a younger audience. Yeah.
How did you like decided you wanted to like go into pharmacy? It was like a dream of yours, like from a young age, or it was something like you just wanted to try? Like, oh, how was the process of thinking like, oh, I want to like be a pharmacist?
Well, from a young age, I didn't think I wanted to do anything people facing. I didn't think I wanted to do anything clinical. Like I was like, I don't want to go to medical school. I don't want to go to nursing school or healthcare school. I just want to be a scientist. And then after I did that, I was like, this isn't fun. I'm not out in the field. I'm just with my little glass slides and the microscope. This isn't fun at all. So then I pivoted and I applied to the healthcare professions. Pharmacy accepted me. That's basically it. Like medical school here is very competitive. There aren't that many options for medical schooling in Canada either. Like we don't have doctor of osteopathy schools, and we have, I think, maybe like 12 medical schools for the whole country. So it's very competitive. I did not get into medical school. So I decided, you know what? It's doing a very similar thing in pharmacy, and I will have a very in-depth clinical involvement when I graduate as well. So let me try this out. And I thought I could always apply to medical school later, but then I didn't want to anymore. Like I was really happy in pharmacy.
No, like you told you're very good in school, and I think like when I watch your videos, the amount of studying you do is like unbelievable. So I wanted to know like kind of your tactics on how you like kind of learn because you like even had like you had time pressures, you know, so many courses like to take. Even I think we can talk about that too. Going kind of have this like from Canada to not Canada, but Canada, America kind of license on pharmacy. And I think like that was the other thing. So how do you kind of like even now think about kind of studying and teaching yourself like all of this complicated stuff?
Yeah, for sure. I took a lot of exams to go from Canada to the US for my license. And the way I approach any course or any standardized test, I will say I'm very good at standardized testing, is to first look at their syllabus or their exam contents. So usually when you look at exam, they will publish what they're trying to test in which areas and how much those areas are weighted. That's really important, I would say, to understand a roadmap of what you're going to study. And then for me, I really do well with practice questions. So I learn by trying it once or twice and having that in my memory rather than just making notes. So wherever I can, if I have a test coming up, I do practice questions as much as possible. I spend almost all of my time in just practice questions and maybe 20% of the time reviewing content in the books. And usually I will go back to the content in the books to do that. And that's only when I review my practice test answers and which ones I got wrong. Otherwise, I don't make it too much of a habit to go through the books. When I do, I try to make up one pagers. So for me, when I'm actually studying just dry content, not doing practice questions, it's really helpful for me to map out thought ideas in a single page. So I like to use OneNote for that. And I will make out entire pages by topic. So for example, one page is called anxiety for anxiety treatment. And I will go down like anxiety diagnostics, signs and symptoms of anxiety, rates and prevalence, like how likely people are to get anxiety, what causes anxiety, like risk factors, things like that. And then I will go through and I will look at treatments and I will list out the treatments, like what is used to treat anxiety, like what are the different side effects with each treatment. And I'll break down everything related to that one topic in one page. And then it helps my brain when I'm physically moving those boxes around or drawing connections to have it almost like a map that then I can recall when I'm writing a test. It does help spatially to have that information laid out.
Interesting. I would like I would like to get a little bit off like a little bit topic because you mentioned anxiety and that kind of brought me the thought even like to those like medicines about antidepressants and like all of those anxiety which mm, I've heard like mixed opinions about kind of like all of these kind of like to simplify it in my terms those chemicals in your in your brain like that are you know supposed to kind of make you happy but it creates a chemical imbalance and all of that and I think a lot of people especially in today's age with kind of like many people say we have a mental illness crisis which is sad but it is how it is. Many people use those antidepressants, and I think many people don't know what they actually do. And other even scientists or something like that are kind of turning that it's just placebo and all of that. So I wanted to know your opinion as like a literal pharmacist that kind of is in this field, and what's your opinion?
Yeah, I think when it comes to what we call psychoactive or psychotropic drugs, medications, including antidepressants, they are very important because they help restore neurochemicals to a baseline or close to a baseline functional level. But I think what we need people individually and on like a larger government scale need to understand is the the chemicals themselves, the medications, are important in order to get people to a state where they can then participate in longer lasting interventions. So, for example, if someone has anxiety, but it's very debilitating, like right now they can't even go outside, the medications can help them to a point where they can go outside, participate, and meet therapists and build a friend group or a social group that they can consistently spend time with. And those are ultimately the things that will reduce their anxiety or reduce their stressors. So maybe someone has anxiety and then the medications help them enough to sort out their living situation so that they are stable long enough to sort out their living situation. They have a roof over their head and they no longer have to worry about being homeless and living in their car, for example. I really hope that people start viewing these medications with the power that they have, but realize that they are the boost to get people to a point where they can set themselves up for stability long term. Because I think a lot of mental health concerns, especially in the modern era, is related to external factors. And it's maybe not necessarily that our brain evolution has changed very much in the past 20, 30 years, but that life stressors are a lot more complex today than they were back then. And we really need that follow up, that follow through of other non pharmacologic measures to help with these mental health concerns. And that is reflected in the guidelines as well. So professionals have these published guidelines that will talk about what is recommended for treatment of these conditions. And medications is usually top one of two or top one of three total recommendations for first line treatment. And usually one of the other ones will be psychotherapy or like some sort of social and emotional intervention.
Interesting. So yeah, like what I heard, like you said, it's more of a like it's not the this will fix your problems kind of thing. Is if it this can help you make real changes in your body and kind of help you fix this kind of thing you're
Hmm.
dealing with. And with that, like I think you made an interesting point in we don't have a really like a different brain from what we had a few years ago, but those kind of mental health like mental illnesses like kind of just are a lot more common, and because of the kind of complexity of of just those problems. And like for example, like what do you think are maybe even like people that may help you or something like helps from even those medications and all of it. Don't know how, like if I said this question right, that maybe even help people that or make them understand that why are they this way, because I think many people think that if they have this mental illness, like they are something wrong with them and they need this medication or that medication, or they kind of are even kinda afraid of it, afraid of kinda admitting it. Like, why? What would you say to them?
I would say that admitting it is the first start. Like, this is a starting point. And I hope that people don't see it as a negative thing. I know that there are cultures and it may be difficult socially to look at it that way. I know I had a difficult time myself when I was first diagnosed with ADHD. I thought like, am I just this now? Like, am I not going to achieve anything because this is how ADHD people live? But I think looking at that honestly as kind of like a reflection, like this is how you are currently in the living situation that you find yourself in the career that you are working in, and understand that the diagnosis is not about them, the biologic individual, is more about them in their social setting, as more like a description of their current overall state would help people more in understanding how things outside of themselves also need to be changed. So, changing their situation, taking medications towards that end, and how medications can help because of the situation they find themselves in. Because, for example, like if we go back to anxiety, if someone is diagnosed with anxiety because right now they're living in their car, they're not able to afford tuition in the program that they're in. And so, because of that, they don't have enough to eat. and they're not functioning at their best level, so they're also failing their courses. Like, I think when a person like that receives a diagnosis of anxiety, my hope is that they don't take it as something wrong within themselves, but they also are able to look broader to the situation that they're in, that like, yes, I'm anxious as a person who has all of these external factors going on. I think that may help some people be able to then take the steps necessary to improve some of those situations. And maybe, like, for example, like they still want to complete school, but maybe it won't be at this program paying this amount of tuition. Or maybe they're not able to do all their classes right now, but they got to focus on having shelter, living wherever they can. So then they hold off school and they start working. So I think there's, like I said before, there's a lot of complexity, but I hope that people won't receive a diagnosis as a sole judgment upon just the living creature aspect of this whole situation that they're in.
I do agree because, like, essentially, I think those when people have these mental problems, I don't think they define them. They like certainly like make can make a lot of things harder and make a lot of things harder, but like I think like yeah, as you said, they should kind of look at all of those factors and kind of make improvements like where they can and kind of see things realistically and don't see it as like end of it all. And
Mm.
like one of the last topics I wanted to touch on, I found it really interesting, even you talk about it in your videos, is kind of this college debt and like the amount of like money, even like all of people, but even pharmacists and doctors like kind of flood themselves in, like when they are taking like make like paying money for college. And like I find it really interesting because we don't have that in my country. Like I think most of the colleges are for free, and I wanted to know like how it works. And I think even paying for like those that you in America you have, like not in America, but taking those American license for pharmacists, I think they cost a lot of money too. So I wanted to know kind of your perspective on that, and even how it works for somebody that doesn't kind of know or doesn't kind of know how it works in America, for example.
Yes, yeah. So I would say for in America, I'm not too certain on their university schooling practices, but in Canada, I will say there are different prices for domestic Canadian students versus international students going to Canadian schools, because Canadian universities are to a level subsidized by the government. I don't believe we have private universities, or they would be very small. Like private universities are not not as much of a thing in Canada. Almost all the large universities are public, so they receive public funding. And part of that then lowers the tuition for students who are part of that public population, right? So if I were to do an undergrad in Canada, my tuition at the time, like 10 years ago, was about 4,500 per semester. So I would pay like 9,000 a year. And so over 4 years, maybe that was like, actually, now I don't even remember. I think it might have been 5,000 a year. So then it was like 20,000 for the 4-year degree, which is still very little compared to how much US universities cost. So that's how the Canadian subsidized system works. For medical school, the Canadian government subsidizes that even more, so that when medical students go through, they pay about 20,000 a year. And that is cheap towards how much the whole thing would actually cost. For pharmacy, I want to believe maybe it gets subsidized. I'm not too certain, but we also pay about 20,000 a year for pharmacy school. Dentistry is very similar as well. So then after 4 years of pharmacy school, I've paid maybe about 85,000, 85 to 90,000 with like summer rotations, the cost of summer rotations in there as well. So that 90,000 Canadian is still very cheap compared to how much American pharmacy school costs. I think some commenters on my videos related to those schooling costs were saying that their American pharmacy school costs them like over 200,000 US dollars, which is a lot. And so the price of schooling is very different country to country, even for the same job. When anyone asks me how much they should spend on school or what they should study based on tuition, I always go by this general rule of thumb, which is that the total cost of the training program should be cheaper than, or at most as expensive as, the single year of income you make immediately after graduating. So for example, if I can make 90,000 as a pharmacist at that time when I started, if I can make 90,000 as a pharmacist, then 85,000 for 4 years of school is okay to me. But then it gets difficult when there are programs like where it costs you 100,000 to take the program, but you could only make maybe like 40,000 out of school the first year you graduate. Then that portion is like makes it very hard to pay back student loans, I would say.
No, I honestly, some of the prices are kind of unbelievable, and especially like you talk a lot about like it's hard to kind of find a job as a pharmacist, even like of course like as a doctor, and I think a lot of other people too, and I think if you made a series like 100 rejections, which is, I think, a good mindset to have when, honestly doing any kind of cold outreach or doing something along those lines. So I wanted to know your approach on even finding like a good job that, may even pay those, like student loans and all of that, because I think it's pretty hard. Like, I don't know how is it in America or Canada, but it's like in my country, I think it's pretty hard. But of course, it depends on the job. So
Uh-huh. Yeah, I will say it is hard to find jobs here. There are certain professions where it's easy to find jobs, certain ones where it's difficult. I know a lot of my friends, for example, who did the cellular biology and genetics or biology with me in my original undergrad, like they are having trouble finding jobs here that pay at an adequate level, that is reasonable working hours and so on. So I don't know, it is really tough because everyone has a different situation. And for me, that's when also I decided like I need another degree or I need to study for something more, which is pharmacy. After finishing pharmacy, I will say it's easier to find jobs in pharmacy just because there's always need for healthcare. So, yeah, finding jobs is difficult, and I don't discount that in a lot of people's professions or a lot of people's study paths, like it is quite difficult. But I think with it being so difficult, there's really not much to lose. And internet connection these days means that we are able to reach out to a lot of different people very far apart, and it costs us relatively little to keep trying, basically. Yeah.
yeah, and do you think like having personal brand helps with even finding a job or even like having those connections? Like you said, like it's a big benefit, but wanted to know like if you would, for example, recommend all other students of, for example, like pharmacy or doctors to start their personal brand.
Yeah, I think my real life friends who have talked to me can attest to that I have been telling people to start social media and personal brands. Like my hairstylist friend who helped me do this hair, I told her like you got to start posting on Instagram more because, hair is so visual and you will definitely get more clients. Or other pharmacists friends who I talk to, like I talk to them like, just make yourself visible because the people who get the jobs are the people who others know they're there. So yep, I definitely tell that to people in real life as well.
Yeah. Okay. And yeah, I wanted to kind of end on this note. because like time's up, and I just wanted to thank you for this because like as I said before the podcast, this is a kind of field I don't know a lot about, so like I hope I didn't talk much off topic or something like that. And yeah, I wanted to thank you for like for first for like what you're doing, and I think you have like great intention and you're making like a good knowledgeable content. And for like the second one is for being here because yes, I hope you enjoyed this, and I wanted to thank even the viewers for like watching till the end. So yeah, thanks for being here.
Thank you. Thank you for this interview, and thank you, viewers, for watching.